Now this is the slide they will see. It simplifies it for them. We'll be asking for their height, weight, tobacco use. Generally by now you may already know the income, the company they're working for, how long they've been working there. You may know the mortgage payment, monthly payment. What are their retirement or savings asset? What money are they going to fall back on? Again, you don't want to use retirement accounts to pay for medical bills and final expenses. Oftentimes, commonly, that's what they use for, but the person left behind now has no money to live on. Again, most retirement accounts are wiped out because people, use those retirement accounts when they become sick and pass away. So it is not good. They have retirement accounts earmarked for retirement so that both he and she can have as much money to live on into retirement without becoming dependent on Social Security alone. Any current policies, and then we get into the health, and I'm going to spend the majority of the time on that. I highly encourage you to print this off. This is basically kind of a pre-qual letter. If you honor it, it's awesome. Again, you may have been taking notes all along the way. So here you can write down their names, get their date of birth, their current age, height, weight, last use of tobacco, any type, even if it's marijuana. Here's their job, income, children, mortgage, all the things that we just were speaking about right there. So let's get down to the health real quick. Now you want to break this up into sections because if you miss one thing, it could keep them from qualifying for the program. So the better you get at this, then the better off you will be. So first, get a list of all their current medications, and that includes medications they only take as needed. You may have to remind them of that. They might be on asthma medication, take occasional pain pills and things, and they can forget to tell you about it. So you want to get the name, dosage, and reason, and if it's as needed, you want to get what their average use is. They're going to say, well, I only take it as needed. Oh, really? So how often is as needed? Do you take it once a day, once a month, 5 times a day, twice a year? That's a big difference. It shows the degree and severity of that issue. Let's take asthma for example. You got people who take it once or twice a year because the seasons change. However, others take it and say, oh, I don't use it that often, but they're taking it twice a day. There's a big difference in the type of asthma you've got going on there. And so it's very important to try to get that out. Asthma can turn into COPD or emphysema. So obviously the more they're on those type of medications, and having to use it on a regular basis, it can get to the point where you may have to ask them if they have COPD. So I've got down here, and we're going to cover that, but make sure you're on the as-needed medications to get it. Now, this is another thing you want to ask. Have they had any past major medications they're not taking now? They may have been on depression medicine, memory medicine, diabetes during pregnancy. These things can pop up on the MIB and Prescription Bureau and cause qualification issues. So again, the better you get at asking this, the better off we're going to be able to call. Now, if you don't ask, I'm going to when you call in from the table, but I want you to get in a routine and just ask and break this stuff up. So ask for current, and then once you got all the current, ask for any past major medication. Here we come down to major illnesses, and I look at either one of them, go, have either one of you ever had any major illnesses? Now, I don't say major illnesses, operations, procedures, tests, x-rays, hospital stays, blah, blah, because they only remember one thing. You want to break it up. Have either one of you had any major illnesses of any kind? Any diabetes, cancer, heart issues, stroke, mini stroke, which is TIA, bipolar, depression, anxiety, COPD, emphysema, asthma, You know, you want to kind of go down this. Now, there's a lot of other illnesses over and apart from this, but if you go down this litany right here, they're going to offer anything over and above that. Typically, is there anything at all? Now, if they've got diabetes, here I've got the rest of the questions. Age of diagnosis. Are they on insulin? What's their A1C? It should be 7 or less. And if it's above that, then that may be cure dependent. Do they have any complications? Well, you can ask them if they have any complications. They're going to tell you no. So it's best to say, so you've never had coma, anything, diabetic coma, anything wrong with your eyes, nerve endings, circulation, amputation, heart, stroke, kidneys, wounds, and I'm looking at them. And they go yes or no. But I've had people say, no, I don't have any complications. And then when I went down this litany, they go, well, I had 3 toes amputated last year. Or I had some kidney issues. In fact, I'm on dialysis. So, yet they told you they didn't have any complications. So the better, just go down this litany. Do you have to know these diseases? No, that's the reason why I've got it written there for you. And again, that really just helps to keep surprises down. It's not that we can't cover them. It's just making sure we get the best program they're going to be approved for out the gate. If they've ever had cancer, when was it diagnosed? Do they know what stage it was? What treatment did they have? Surgery, chemo, radiation? When did the treatment end? See, the carriers ask all of these questions. So I've got it right here for you, Bing, and you can even go back later and look at it. Are they disabled? What's their prognosis? And have they been recovered? Heart issues is more than just a heart attack. Men are really bad about just saying, have you ever had a heart attack? Well, there's a lot more heart issues outside of a heart attack. Angina being one, which is a precursor to a heart attack. And many of them are going to say, no, I haven't had a heart attack, but they still have had a stent or a bypass because it prevented the heart attack. But they say, no, I didn't have a heart attack. So again, say, have you ever had any heart issues ever? Any heart attack, angina, stents, bypasses, valve repairs, atrial fib, which is an irregular heartbeat, pacemaker, murmurs, anything, and, they'll go yes or no. Strokes, mini strokes, which is a TIA, bipolar, depression, anxiety, COPD, emphysema, asthma. If they have had any of the breathing ones, how often did they use their inhaler? And we're going to get into the hospital visits. So generally this is going to cover the majority of the things that you see. It's not going to cover everything that might pop up. But by the time you've gone down, they're going to be volunteering anything additional on top of it. Now once you've got the illnesses, ask about operations. What their operation was for and why. And that includes procedures, any tests or x-rays they may have had, and what were their hospital stays, roughly when, what was it for. So break it up, you're going to get best answers. Have you applied for life insurance any time in the recent past? The carriers ask this over and over again, and they do see that if in the past year or two, if they've actually applied. And so sometimes you get a question from them, from the carriers. It looks like this client has applied for life insurance. Do they still have it? How much do they have? Have they, what happened? Were they rated denied? Did they still have this life insurance? So it's more of a disclosure. And again, that's the reason why it's in bold, is because you're going to get it. And so you might as well ask about it. Any criminal or driving record, and, date probation ended. So, felonies are, a high-risk behavior. So is drunken driving or speeding tickets. They may be quite healthy, but they have had a criminal or driving record that can be of concern. So the main thing is did they serve jail time? In fact, jail time, kind of include that in here. And when did they get off probation? When did it end? Okay. End. So therefore, you're looking at, when did they get out of jail? when did their probation end, can determine which program. Most of the carriers, to get a prime product like the term, or Smart UL or IULs, they have to be off of probation at least 2 to 5 years to be able to get those programs. If they're on disability, is it a work disability, a military disability, or are they on Social Security disability? The Social Security disability indicates it's usually a pretty permanent disability. People can be on military disability but still work full time. But if they're on Social Security disability, then that's considered a permanent problem. Whether it was related to injury or illness, here just notes to write. Wheelchair, oxygen. If they've had any breathing issues or ER visits or on a ventilator, this happened the other day. I got detail with the agent, because they didn't know to ask these things. And I asked about hospital stays, and they had been in ICU for 2 weeks. He had had cancer treatment, but it was on the lungs, and he wound up on the ventilator for a couple of months. Military, when are the orders for deployment? We can usually do military, but if they've got active orders of deployment, that is a concern. Citizenship, again, they usually like to see that they've been in the U.S. for 2 years, or if they're a snowbird from Canada, that they are in the U.S. at least 6 months out of the year. Do they have a Social Security number or not? And of course, if there's any high-risk lifestyle, then you can have it too. But you can see you're really taking a nap from this. At this point, you call from the table and say, hey, Mary, Joe, I'm here with Mary and Joe. They're wonderful folks. They have lived here for many years. They've gotten a recent refinance. And Mary's really, Joe's really worried about Mary, that Mary would lose the house if he passed away. He's not as worried about her, but he makes, he's really worried about it. And so he wants to try to find some type of mortgage protection program. How you position it when you're calling is huge. They're going to feel like they're listened to. You're building it up. And I'm just trying to find the best program and get the best thing possible for them. They're going to love you for it. And you're going to say, let me start with Joe here. Joe, his date of birth is 1/1/1956. He's 60 years old. His height, weight, he last used tobacco, and just go from the top down to the bottom on both of them. And I promise you, it works like a charm if you do that. Again, always lead in the why. Really build them up. Be complimentary. Joe's a good man for thinking about caring for his wife, Mary. He's really concerned. He doesn't need as much on Mary. That's going to tell me what you're shooting for, and how to help best position it. Again, I got a big medical background, so I know what these underwriters are doing. Many of your leaders know what the underwriters are, and we're going to help you write the best program possible. And we're going to tell you what's going to work the best for them.